Every great sporting performance has a team behind it. Coaches, physiotherapists, nutritionists, psychologists, and when injury strikes, surgeons. While athletes stand on the podium or step onto the pitch, there's another story unfolding behind the scenes. One of clinical judgment, rehabilitation, and countless decisions that determine whether someone returns to competition and when. Today, we are pulling back the curtain on that world. Welcome to Behind the Best, the podcast by Fortius Clinic. I'm Talia Lazarus, and today I'm joined by two surgeons who have spent decades helping elite athletes recover from some of the biggest moments of their careers, Mr. Andy Williams and Professor James Calder. Together, we are going to explore what really happens after an elite athlete gets injured, how return to play decisions are made, the pressures that come with treating athletes at the very highest level, and why the same principles can benefit every patient, not just professional sports people. So Andy, James, welcome.
Thank you.
Thank you very much, Talia.
So for the listeners, I want both of you to briefly introduce your role at Fortius and the type of athletes that you treat most often.
Thank you. So I'm Andy Williams. I'm a sports knee surgeon. I stopped doing joint replacement some years ago because I got so busy with the professional sports stuff. I set up with a couple of other people Fortius Clinic, and we wanted to be able to deliver a service that we felt was fit for these sort of people, and of course many others as well. And I've been doing this a very long time. My first athlete that I treated was a Chelsea footballer in 1999, and so it has been a long time.
A little bit.
And I'm James Calder. I'm a foot and ankle sports surgeon. So I got into sports injuries just after Andy. And I knew Andy when he was the senior trainee and the senior registrar at Stanmore. And I was very junior. And I also got an interest in research as well as Andy. And we were lucky enough to support the innovation of Fortius Clinic right from the start, and it's been a wonderful journey getting a group of people together, but also including a lot of research, which is my bent, as well as dealing with elite athletes, which is now my specialist subject, if you like. And I'm very lucky that I don't see many normal individuals anymore. They are certainly a select group, slightly high pressured, but that's what kind of gives us the buzz, I think, really.
But also, you mentioned the research, and so much of what we do now with our pro athletes is based on evidence.
Yeah.
Because between us, I'm sure we've done thousands of cases and followed them up properly. We publish both of us, and the data is invaluable. It lets us know the best treatment for the condition in front of us, and it's been very valuable.
Yeah, and also I think it's important to know that when we say we're doing something, we can validate that. And we can also turn around to the athlete, the coach, the manager, the agent, whoever it happens to be, and actually say, we know that this is the expected time frame for you to get back. So we know you can or can't make the Olympic Games or the FIFA World Cup because on balance, this is the expected time frame. And you'd never have that unless you had very, very controlled data, which we've both been able to.
And the amazing thing with these special people is they really test what we do, and so they help differentiate the outcomes of different treatments. If you look at the research on the general population, often all treatments look the same, but with these people there's usually one thing that works, and it's invaluable to know that, not just for the athletes, but we can hand it on to the general population, so we really get to find out what's good and what's not so good.
I think that's one thing that does get lost sometimes, is that yes, we're dealing with elite athletes, but the research and the data that we can collect, we know we can control things, so we know what would happen, and we can translate that elite research, if you like, into the general population, which can then be used widespread in the public sector, both here and abroad. And actually, that's been really, really useful.
I mean, obviously, I'm not a professional athlete or an elite athlete, but after my ACL reconstruction, I remember my head was very much ready to get back into things. Yeah. But physically, I remember speaking to surgeon and my physio as well. Physically, I was not. Yeah. But that data, I guess, is there to know that I was on a schedule, and it can change, but I am on a schedule, and I kind of had to stick to
it. The tough thing is it just takes so long. And there are very few things in modern medicine that takes so long as the recovery from an orthopedic injury. In the old days, people would see disabled all over the place in society because the treatments weren't available. But nowadays it's a rarity, and we're not used to having to wait for the outcome of treatment. And to a certain extent, we have to wait for nature, as well as the many months of hard yards of physio.
So then between you have worked with Olympic athletes, Premier League footballers, and elite competitors across multiple sports. What first drew you both into sports medicine and orthopedic surgery?
Orthopedics for me, it's fun. It's it's a wonderful thing to be involved in because you can make real changes to people who want to get better, who've been striving to be sports people, and they have an injury. They're driven to get better, and actually, you can do something about that. So it's not like dealing with other areas of medicine, whether you're a neurologist, where there's not a lot of good news to give out, or and dealing with cancer surgery, which is so incredibly serious. We're very lucky and very fortunate we can deal with that. And also having a passion for sport. I'm not particularly good at it, but I love it. That is it's a great way of actually being involved, still involved in sport. And there's so much the cutting innovation that we could do. So 25 years ago, over the last 25 years, there's been a huge revolution in what we can do for athletes. And Andy and I have been lucky to be part of that wave that's really transformed. And years ago, a lot of the athletes used to fly to the States because that's the best place to go. It's interesting that doesn't so much happen nowadays. It annoys my American colleagues that they're actually flying this way now, which is great. And I apologise to my American colleagues, but it's coming this way now as well. And so, from my point of view, I think it's been the interest and the challenge that elite athletes present, and you've got to get it absolutely right. And that's you've always got to be on your top form.
I think orthopedics drew me in as a student. I liked the subject. It seemed very practical and logical. Plus, like James, I love sport. I happened to work for an orthopedic surgeon, my first ever job, and he was a lovely, lovely man, Michael Mowbray from Croydon. And he influenced me without me realising properly. And then I worked at the Royal National for an amazing professor, George Bentley. And those people gently draw you in without you realising, I think. And then, so orthopedics, it's blessed because we have some fantastic treatments. And as James said, it's come on a long way. I had my first job, and knee replacement was a bit of an unpredictable procedure, whereas now it is one of the top operations that can be given out to anybody, same with hip replacement. And then sports medicine's changed so much over the last couple of decades. Our ability to use tech, our ability to use arthroscopic surgery has just revolutionized it, and it gets better and better. And I find the whole study of the knee fascinating. I mean, both of us still read papers, write papers, edit, teach, because I just have an absolute love for the subject, which helps. And then with the sports, I think the key thing for me was the challenge, being able to rise to that. And I've realised it's made me so much better for all my patients. Because as James said, you get one chance. You don't get a second one. You've got to get it right first time, every time. There's a lot of pressure on, but if you can deal with that, you become better.
I have to be honest, I agree. I find orthopedics in general extremely fun, and I find it so interesting. And I remember when I came in, I learned so much about my knees. I had so many questions. And now I find it such a fascinating topic and conversation. And you're right, even when I look at my scars, I've had major knee surgeries and they're tiny. They're the tiniest little scars. And obviously I know in the past, scars were bigger, but how to have an ACL reconstruction and have a scar that's barely visible is just beyond me, in my words. So thanks, guys. So then when an elite athlete is injured during a match or competition, what are the first 24 to 48 hours actually like behind the scenes?
Well, the phone goes off.
Yeah.
You may actually be watching the match, and you kind of go, "Oh, okay," and then your phone goes. And I think it's usually the weekend, and we've got we've got great teams around us here at work at Fortius, but we've got a brilliant team. Both of us are very fortunate. We've got a brilliant team at home who understand the situation.
No, I think that's very important.
Saturdays and Sundays it can be fairly chaotic in looking at MRI scans, getting calls, and then discussing with patients and discussing with the players because they need it right now. They want to know exactly what's happening, because it's so important. There's so much money, say, in football, that days make a difference, and they want to know and be able to predict what's going to happen.
people are getting scans now Saturday, Sunday, whereas they probably didn't when I started out on this journey. And so there's always a bit of a delay, but now there's no delay. So you say the phone calls are incredible, and you have to get everything organised. And even if you've got a fully booked clinic, you've got to make space, you've got to have a plan. And so the beginning is about really planning how you're going to take this on. It's the clinic appointments, and then whether or not you need to do surgery. If it's obvious you need surgery, then you'll be thinking, when am I going to do this? So it's all there, ready. And I think it's very reassuring for the players that they know there's a plan. Limbo's not good if you're a pro athlete. Your whole career depends on the joint affected. And so the emotion is a lot greater. It's not surprising. And for most of us, if we get an injury, it's not going to affect our career probably. And so the pressure within us is so much less.
I think the key thing is the team aspect, because we'll know most of the teams will have worked with them previously. But we'll then also have the team back here. So we'll have the radiologist. We'll discuss a scan when we know there's been an injury. We'll discuss the scan with the radiologist. We'll then discuss it with the team doctor or the team physiotherapist. And we'll maybe phone the player and even have a Zoom call with the player in advance over the weekend to discuss things. And then we talk to the secretary. The secretary's on 24 hours as well, so that we can sort out maybe a theatre slot for the Monday, the Tuesday afterwards, or the clinic appointment where there isn't any because we're completely full. So it's a whole, and the anaesthetist. We've got very understanding. We both have the same anaesthetist. He's very understanding that. Are you free 7:30 Monday morning? Because we are, and it happens, doesn't it?
Very much so. But that support has made it easier over the years. I guess we've demanded a team, and we've been very fortunate to get it. And even transferring scans can be a major headache at the weekend, but we have people who are able to receive them and upload them so we can look at them properly. They seem little things, but they're massive.
And then they're flying in from abroad. Getting somebody in from abroad. Maybe somebody doesn't have a visa. All those things. Well, I don't want to have to deal with that side. You do need a good backup team here at the clinic to be able to sort all that admin out for you, so you can actually concentrate on what's actually needed.
So then, with all of that in mind, how do you decide when an athlete is ready to return to competition?
There's a lot spoke about it. It's an area of considerable interest, particularly ACL surgery. Go back too early, the thing will break, and the player probably won't play very well. But if you delay it, then maybe you're missing time unnecessarily. So it's obviously very, very important. There's a huge amount of research going into measuring certain parameters of muscle control, muscle strength, etc. But sadly, none of the systems really work perfectly. So we've yet to find the green light, red light option. In my world, basically, the patient needs to be confident. If they're not, there's a problem. It may just be they need more time. The knee needs to be dry because swelling is bad juju, if you like. It's not a good thing to have in your knee. And it means the knee isn't ready. The knee's got to examine well. It needs to be a good job that's done. Patient needs to be aerobically fit, because if they're not, they'll fatigue on the pitch, muscles go loose, and then they might break it again. But the magic really is that there's symmetry. So that when we observe the function, strength, etc., whatever you want to test, it should be well within 10% of the other side. If there's a big difference side to side, the patient's just not ready. And they need to tick all those boxes. And so for me, I try and keep it fairly simple, really.
And there isn't a sort of set algorithm, because every patient is slightly different. Because you can have some patients will be ready, say, at 4 months after a particular injury, others at 6 months. Some of it is, there is a big psychological element, which I've got to know a lot more about in the last 20 years than I ever realised beforehand. You can have a big, rough top rugby player who's physically absolutely fine, but they won't get back on the pitch, and they can't get back, and there's something going on, and there's this fear, catastrophization, which I never was taught about at medical school.
Not.
Really talk about this. We never talked about it during our training. And so there's that element. There's all the nutritional things that go along with it as well. But I think it's something there's certain teams we've worked with a lot, and we know that they've got the confidence to know their individual players very, very well. possibly the difficulty comes when there's a new player coming into a team with an injury, and they don't know how that player reacts. Sometimes I feel that has something to play. And then finally, there's the selection bias, the managerial pressure to get a player back can be very difficult for the medical team to handle in a particular club, because they're under scrutiny all the time. Well, we want them back this time.
Also, with that length of time out, they've changed managers. And the poor player was, king of the castle.
2 or 3 times if it happens to be some clubs.
Can be king of the castle and then end up not being selected and not featuring. So, if you look at the time to return to play, it can be artificially delayed by not being selected, or if there's an off-season, of course, as well. But our duty really is in pro sport, is to get the athlete back as soon as is safe. Whereas with general population, we can afford some slack and take our time and absolutely know it's okay.
And I think also the other bit that's different with the elite athlete is keeping them otherwise fit whilst that injury recovers. So they will have all sorts of other things going on to make sure that when their knee will work or their ankle works, actually they're not trying to catch up with the calf or the quads on the other side, because you've kept them going, you've kept everything else.
You see it again and again. The player gets back from the ACL, then they do the groin or they do a hamstring, and it's that match robustness that doesn't come just with doing rehab. You have to be out training and build, and some of them get unlucky.
The psychological element is a real thing, and obviously I can't speak on behalf of everyone, but when I look at footballers get back on the pitch after an ACL surgery, and having had one myself, I rate them, because I know my mind and I just think, wow, they've been through, obviously what I've been through, but in their own journey, and they can go back to that. And I think it's an amazing thing.
Yeah, I think that with the preparation for return to play, they will have undertaken those manoeuvres hundreds, if not thousands of times, so they know they can do it. But there is still a moment, though, if you're going to your first tackle or whatever it might be, that there could be doubt. And different players have different levels of confidence. And there are the special players who, when they walk in a room, everyone goes quiet. They command the room. They have this ability. And, we've had the privilege to work with these people. And then there are probably the average ones who are very self-confident. And if you're on a pitch, you've got to know that you can beat the person opposite you. But then there are another group who are very nervous. And some actually find playing their sport very stressful, even though they're very talented. And that can be quite a burden for them. If they have an injury, it's even worse.
See, I played in a charity football match last year, and I remember saying, I don't play football often, it's my first one ever. And I turned to the team and I went, absolutely do not put me in defence. I said, because I won't tackle anyone. I said, put me at the front, I'll go run after the ball. I was like, but I will not tackle anyone, because the idea of sliding in for something like that after what I've been through, absolutely not.
No, it's understandable, isn't it?
So then, James, you've worked extensively with tendon injuries. What are the biggest misconceptions athletes have about tendon recovery?
I think the first one is to think, well, it's not a fractured bone. And you kind of go, no, actually, fractures by and large are easier to deal with. They are probably a little bit more predictable. Tendons are very unforgiving, and there are certain tendons like the tibialis posterior tendon and the Achilles tendon, which are the Achilles it can be a disaster in an elite athlete. One of the stats that's still out there is that if you've got an NBA player, so basketball, between 28 and 32% of basketball players will not get back to professional basketball at the NBA after an Achilles rupture. End of story. It's also the fastest deterioration and early retirement. Forget about an ACL, a meniscal injury, a spinal problem. It's the Achilles is the worst in those sports. And still for professional football, it's thought to be somewhere around 22 to 25% of professional footballers in the literature. I don't think it's as high as that. I think it's become less, but that's probably not because the surgery's got better. Speaking as an orthopaedic surgeon, I think it's because we understand the rehab better. And being actively involved in the rehab and understanding that process has been a real lesson to me. And I was speaking at many meetings recently about the fact that I wasn't taught about rehabilitation when I was a registrar or a trainee. I learned that from learning from other people, and I suddenly realised how important that really is, and to actively be involved in that. So I think the recovery from, say, an Achilles rupture is determined by the rehab. Surgery, yes, okay, first bit. But then what we used to do was perhaps push them too quickly, and you say, oh, yeah, we should be able to get you back in 4 months, 3-4 months. That's absolute rubbish. I now say to a professional footballer, the median time to return is 9 months. If you get a little bit quicker than that, great, but we'll take you on a sort of a week-by-week basis to get you to the right place. Because not only is there a re-rupture rate and problems, but there's also, you can pick up hamstring injuries are not infrequent during the recovery, return to play. So those are the misconceptions are probably the return to play after a tendon injury, and also that they're not as bad as a fracture. Well, I disagree with that.
I guess as well, you mentioned about how other muscle groups or tendons can flare up or get injured. I mean, everything is overcompensating, and also the leg in general is weaker.
Yeah.
So it's more likely things like that are going to happen.
Absolutely. Yeah, that's where the conditioning is so important. And as well as doing the work, but assessing the areas that perhaps need a bit of extra work. And so some of the testing that's done is very helpful for that.
So then, why can feeling pain-free be very different from being ready to compete?
There are patients with a very, very high pain threshold, and that they kind of worry you and I.
Yeah.
We've had them when they've gone into destruction mode, and actually they just say, "Well, I feel fine." I know, but this isn't fine. Trust me, you need to slow up. So I think return to play is such a difficult. It's very difficult to put your finger on when the right time is, and if you've got a player who is a little bit older and a little bit wiser, they kind of have got to know their bodies by the time they're early 20s. If you've got a 17 or 18-year-old who's first injury, they don't really know. They may try and push things because also it's a crucial age to get the agent to sign them or get the club to sign them, and they'll push themselves and can do themselves a little bit of harm. So I agree with Andy that swelling is a big thing. If it's swollen, it's not right. You won't have what we call the proprioception. You won't have the feedback mechanism to know whether it's stable. And you maybe also, if a joint is swollen, then perhaps in a non-scientific way, the cartilage is perhaps a little bit softer, and you may start doing yourself some long-term damage there. Pain, a little bit of discomfort we expect during the recovery, but persistent pain for 4 or 5 hours after you've done an exercise, they need to declare that because they've gone a bit too hard, and they may have seen a physio from outside the club occasionally. Well, quite often. And that's not necessarily a good thing if they're not linked up, if they're not tied up. So I know you and I, we try and link different physios together.
Secrets aren't good.
Yeah, talk to each other so that everyone knows what type of rehab they're doing. So they're not getting, a double hammer on that.
So then, Andy, after a major knee injury, what milestones matter more than simply the number of weeks since surgery?
Yeah, so we've stopped trying to prescribe by weeks. It's some people can get there quickly, some people can't, simple as that. And so the first thing to accept is that surgery is an injury, and just as much as an injury is an injury, and the price of that is inflammation. And so be it an injury that needs no surgery or be it one with surgery, after the last injury, there's a period in which we've got to put the fire out. And so pain, swelling, inflammation are our absolute enemy because they switch the muscle off. As you get more muscle wastage, they also interfere with movement. The most common problem with ACL surgery is failure to get completely straight. And usually that's because the quadriceps won't fire because the knee is too swollen. And I'm sure you know personally the battle you had to get that blinking knee straight. And so there is a period where rest is needed. And in professional athletes, that can be quite hard to explain and accept. But get the knee quiet over the first 3 or 4 weeks. And then the next phase is a healing phase. And at 3 months, pretty much all the healing is done. So I'll examine the knee and stress the ACL if it's an ACL and see what we've got healing-wise. Other things heal a bit quicker, medial collateral ligament, for example. But I check that they're okay. And once the healing phase is finished, we should have full movement of the joint, a lovely quiet knee where the swelling has come down and restored some of the muscle. The next phase after that is they're more exciting, and the athletes get to be happy because they can get their aerobic fitness back properly. They can really get serious strength and conditioning and balance and become agile. And then, of course, effectively become an athlete again. And for running athletes, not being able to run is a worrisome time because they don't know that they can do it. But as soon as they run again, within a week or two, they know they can do the sport. And suddenly, psychologically, they blossom as well. And then, in many ways, the final rehab is actually playing the sport. Those motor skills that are so fine-tuned in these people need to be honed again. And you'll often notice that a player back from a major injury, say an ACL, it's not until their second season that they're the same player. And the first season, they may be a little bit off the pace, not quite standing in the right place at the right time. That some of them have this gift for normally, but it's that repetitive practice that allows them to do it automatically without thinking.
See, a lot of people ask me how long my recovery took, and I don't know an answer because there isn't a definitive one. But what I do say to people is that a year and a half after my accident, I ran a half marathon. So I guess for me, that's how I put the recovery.
And probably you'd have had fine-tuning even up to 2 years.
Yeah. I mean, I can't say, it was the smartest idea doing something like that. I can walk afterwards for about 2 weeks, but I did it. And that's what I say to people. So, but obviously that could be very different for somebody else. I get that. But I'm the kind of person that, the idea was put to me and I wanted to test myself.
And whether you like it or not, athletes are human beings. And they do obey the same rules of time. Now, they may get most of the way there quicker, but the final bits will take just as long.
And then if an athlete says, I feel ready because I know I was there, but the data says that they are not quite there, who wins that conversation?
Well, I think you have to take the athlete seriously. I mean, they know their body better than anybody, but equally you mustn't let them harm themselves. But I can remember a call I got from France, the rugby player, Welsh player over there, and he felt great, but he had a bit of a sore hamstring. So when he had his muscle testing, he didn't give it his all. And so, understandably, the French medical team were worried because he was 30% down on his hamstring strength. And he came on the phone and said, I want to play this weekend, but they won't let me because it's 30%. I said, well, do you feel right? And he's somebody I knew from previous problems, very intelligent man, sensible. And I, on balance, felt he wouldn't do anything stupid. And in fact, he played and scored 2 tries, and he's an amazing player. But so the testing is still not like playing. All of the information we get from the batteries of tests we do are very helpful, but all they are evidence for the prosecution or defence. They're not the definitive answer, unfortunately. And so if the player is serious about playing, then we have to have a discussion. It's a real team effort. There's the club doctor, club physio, rehab, all sorts of people involved in this decision. The older and more experienced I get, the stronger I've become. And I do sometimes say, no way. But I can remember telling a player at 4 months after an ACL, he shouldn't play. He was nowhere near ready. He said, look, I'm a championship player now and there's a chance to get moved to the Premiership next season. I need to play. He played, in fact, was man of the match, first match. Second match, he re-ruptured his ACL and has never played again. So his attitude, unfortunately, was misplaced. I mean, he had an awful injury. There were ACLs and there ACLs, and he had one of the worst ones. And he was just months off being safe to play. And so, and also, I can quote from my own experience, I had a major knee injury, falling off a stage, giving a talk. And I went back to work after the surgery 10 days later. It was utter madness and bravado on my part. And I had to have it redone a few months later. So I can now tell the players, don't be a fool like I was.
You have your own personal experience now.
Absolutely.
Welcome to the club.
Yeah.
So then, who is usually applying the greatest pressure to return to play? Is it usually the athlete, or would it be the coach, or could it even be the club?
It varies, I think, from place to, and all of the above, really. I mean, even family sometimes. So athletes are a selected group of people who absolutely want to play their sport. Out of the 100 girls or 100 boys who show talent at 15 or 16, so few make it. And the ones who make it, they just want to play. It's in their souls. So they have an inbuilt pressure to play. And they also have fears that if they don't play, they'll be forgotten about, etc. And, if you've ever been on a pitch, I'm sure James has, I saw one of the teams get their Premier League trophy. It's a rush. 46,000 people there that day. And even though I was nothing to do with their success, the rush is amazing. So that drug drives the athletes. The family, many of them will be also living off the athlete, not just financially necessarily, but just the emotion of it all, and they want success. There'll be pressure on the medical team to get them back as well. Still, we don't get too much intervention from coaches, but it does happen. And, but it's...
And there can be a conflict as well between country and club.
I've just had that post-World Cup.
Exactly.
I
And it happened a lot.
You have to walk quite a difficult tightrope. But the simple answer is that we have to remain as honest as we can and resist pressure. When you're young, it's really hard. You get better at it because you just know what's right and what's wrong, or as far as you know. And it helps make sure you do the right thing. But, I've just done a medical this morning online. I didn't see the player, but I've given the information that will probably fail that medical. But then the other club are phoning me saying, why has he failed? And so there is tremendous conflict. And I'm going to see the player on Thursday to show him the scans, explain that there are many players with this who are fine, but he hasn't really played much in the last 3 years, probably because he needs to be playing a level below. And because he hasn't got any form, his appearance record is awful, no one's going to take a chance. So the risk is high. But there'll be players with worse damage than that who play week in, week out, and everybody can relax. So I'll hopefully have a sensible conversation, and he'll forgive me. But our job is to be honest.
I think we're lucky in that respect, in that we're not employed by a club, a national club, or a soccer club, or whatever it happens to be. We can be totally independent, so we can purely act for the player and say, look, this is where it is. The club can choose to ignore that opinion if they want to.
I guess we're lucky enough now to have so much work. We're happy to lose a bit.
Being a bit flippant, they can't sack us because we're not employed by them. So they may not choose to come to see us again. Certainly with the transfer medical I did last year, it caused all sorts of chaos when I said, don't transfer this patient, this player, because there were 2 other clubs in the running. But you just got to be honest about it and say, this is what my feeling is. This is what the data would suggest. So, and you come back to science. Always come back to science, and that then it's black and white then.
So then, speaking of elite athletes, do they cope with injuries differently from amateur athletes?
Generally,
absolutely.
Yeah. I would say so.
Yeah.
I mean, they have an incredible robustness about them. They also engage in rehab. I mean, a lot of people would be a lot better in the general population if they actually did the exercises. But when it's your job, it's a lot easier, and you're forced to do it. You don't see many fat athletes. And, if they didn't have the club around them, making sure they ate properly, looked after them, then they'd be fat athletes. We don't see
Do you think they're also pre-selected? They've got to that level. Yeah. And there is lots of other people may have had injuries along the line. They'd never have got to that level.
No, so definitely. I mean, they are just the finest specimens of humanity. I mean, it sounds awful. When I cut the skin, it's harder. The bone is harder to drill. They're put together better. The loading that they go through makes their bodies respond, and they're stronger. And they have God-given talent and ability to deal with things. So most of us who had some of the damage I see in athletes wouldn't be able to perform at all at any sporting level, but they have this ability to get over it. And it is extraordinary. And you must never write off an athlete unless you're absolutely certain. They'll deal with arthritis like nobody else.
Do you think that comes with a mental side of things as well, though? Because this is what they want.
They are some of the hardest people I ever meet. Mentally so strong.
Because obviously when with me after my surgeries, I became like a machine in the gym because I wanted to get stronger. This was for me. I knew what I had to do. But I talked to so many different people who have so many different surgeries that just don't do their rehab.
No. It's hard work.
And I don't get now why, because I have been through there and I'm like, no, I needed to do it.
But a lot of people don't like being in a gym or even doing exercise at home.
No.
And you can't blame them, but it is hard work. I mean, it takes time. and you may not be feeling up for it. But that, our job is to get the plane to take off, but then to get it to fly properly, you need all the rehab. And if you do that, you get a better result.
But also, the physios and the rehab teams are, they sort of create amazingly inventive ways to keep the player occupied. I mean, there's one club that they've even got, they needed some particular things to do with their foot and trying to get the ankle moving, and he just wasn't doing his rehab. He's board sensitive. I can understand why, and they got him to draw and put a pen in his foot, and he was drawing some amazing pictures by the end of it. I said, you should sell them. They'll make a fortune. He's quite a well-known footballer.
Probably would make a fortune.
He said there's another work stream for you. That's fantastic.
Amazing.
But they're very inventive, and let's face it, most of us, we come in at whatever time it is, 6:30 in the morning, and we're in here.
It's work.
Get to go to the gym beforehand for an hour. Well, that's quite a big ask before we get on the train, before we come.
But for them, it is work.
For them, they turn up, they'll be in the gym at 8:00 because they've got to be in and that's their work. Yeah, exactly.
And then obviously, if they've been through a major surgery or injury, it's not just you're healed, you can move on. Is it something that you have to, realise for the rest of your life this has happened and you need to keep it strong? Maintain it at least?
I think the rehab following a major injury is a great value. I mean, first of all, the athletes never had so long to be match fit. And so often they certainly rugby, they want to get stronger, and they do. Same with football players, etc. So there's a benefit, but they learn the importance of maintenance and keeping going with it.
Yes, interesting. With rugby, you can ask another athlete, have you carrying any other injuries at the moment? If you do that with a rugby player, where do you want to start? So actually an injury then probably does give them time to start recovering from a shoulder injury and sort other things out as well, because they've not had that downtime before.
I learned the hard way with maintenance as well. So as someone that's very active, I had a scare last year and my physio sat me down and was like, he was like, where have your quads gone? He's like, this wasn't the quads that I remember post-surgery. And it was a moment for me that I probably needed.
Yeah.
I mean, for the lower limb, chest down maintenance is very, very important.
So then you've both spent years treating some of the world's best athletes. How has that experience influenced the way that you now treat everyday patients, like myself?
I think part of it is being, like I said, being able to use the data and have an honest conversation with you about, say, when you've got this injury, and we know this is how it can work in the best individual with the best rehabilitation. Now, we can do certain things to get you on that journey. So I think that's been helpful. I think because of the volume of the surgery, the volume of patients we've had through over the last 25 years or so, I do think we've got a little bit better, perhaps, in the type of surgery, but choosing the particular type of surgery that you may need, as opposed to, a 6'2" rugby player. And
it's more bespoke, I think.
What, am I not like a 6'2" rugby player? Is this not the build for one?
Definitely not. But a big thing is attention to detail.
Yeah.
You don't get away with things. So having that discipline, and I'm sure James is like me. I've created rituals. I'll always check through the notes, the scans the night before the operation, and think about that surgery. It really concentrates the mind. And you just get into the habits of always doing best practice. And it's true to say, there is tolerance with surgery, but that tolerance in athletes is tiny. Whereas general population and knee replacements are slightly offline. Often it still works very well, and there's no real loss of result. But if you're always aiming at the highest, you're going to get the best results.
I also think there's a choice of when to operate and when not to operate.
As well as who to operate on.
Yeah. So you've got to choose not only the operation that would be suitable for you, also, is any operation suitable for you right now? Can you afford to wait? In the elite athlete, that is often not the case. They will not want to wait. See how this is in 3 months' time. They'll say, I haven't got that luxury. But for you, I would say, well, if there's something, actually, we could wait 3 to 6 months, see how things progress, and we can do the operation. So I think that's I think that's important.
And from your own experience, the way you had your ACL done was exactly how I would have done the surgery if you were my patient. But if you're a professional footballer, I might have used a different graft because we've got the data to prove that's better. And so there's the fine tuning and the bespoke nature of what we do for our patients, which has been, I hope, has been a benefit to everybody, not just the pros.
To be fair, I was asked if I wanted the ACL surgery because I know you don't have to have one.
No.
And I was asked if it was something I wanted to do.
Yeah.
And I turned around and said,
Yeah.
yes, please.
Yeah, I mean, what I would say is most young active people
Mm-hmm.
would do best to have a good ACL reconstruction. Choosing my words very carefully, obviously.
Mm-hmm.
The worst thing is a bad surgery.
Mm-hmm.
But sadly, that still happens.
I'm sure it does, I'm sure. So then what is the biggest lesson you've learned from training elite athletes that has made you a better surgeon for all your patients?
I think the rehabilitation. I've learned so much about that in the last 25 years, and I did go off and spend 3 months doing a rehabilitation course in the States when I first became a consultant, and I'm glad I did that. But I've learned so much more about that, and I've learned more that I don't know as well. And I've learned more about that and the importance of that. That yes, surgery is important, but it's the whole package, and getting to know individual teams very well has been really useful.
Yeah,
I think that
we've
that's
learned.
been key.
Well, I'd say we definitely have learned a lot from the people we work with, the club doctors, club physios, etc. And it's a never-ending learning experience, really. And I'd agree with James. I think the number one lesson has been in terms of rehab. But I think with athletes specifically, it's been their tolerance of damaged joints, and meaning you don't always have to operate. So they're being selective with surgery.
The other point, I'd be as the team. I'm a herd animal. I've never wanted to work in isolation. I like working with Andy. Well, I love working with Andy.
Thank
of
you,
course,
James.
but as a group though, it's been really, really helpful to work where you can bounce ideas, whether it's the radiologists, whether it's the nursing staff, get to know the theatre scrub team. It's really important to have it all together.
I mean, the reason we set up Fortius, wasn't it, was so that we could practice in a way we felt was right, because we're obsessed with being the best. And with that team, it's been tremendous. I mean, we got the world-class radiologists, world-class sports physicians, and we all help each other out, and we all teach each other and learn from each other.
So we have these thing called multidisciplinary team meetings. So we get not just me sitting there looking and saying this is what we're going to do, but we have multiple surgeons, multiple sports physicians, radiologists, all in a room. This happens twice a week.
Yeah.
And it is amazing. I learned so much about shoulders and backs that I never even thought about. During those
but equally, you can contribute a different view on things. I think it's very valuable.
Yeah.
I'd love to be a fly in the wall on one of those conversations. I would. I find all of this so interesting. I'd go away with so much information.
I think, if you look at the hours we work, there must be a reason why we do it. And there's a fundamental fascination with what we do. And it's just been amazing to see the evolution. And then I think the biggest reward I've had is doing research initially in the laboratory, fine-tuning operations on cadaveric specimens, so dead people's knees, and road testing it there, then adding that into the mix with live patients, and then getting the outcome data from the athletes. I mean, they can't hide. We can always find them. So our outcome studies have 100% follow-up or very close, whereas usual studies from general population, a good study will have about 70% follow-up. And so it's given me a massive kick seeing by doing these extra things for an ACL, we can reduce the re-rupture rate in pro football from 7% to 2%. Now that isn't just good for the athletes, that's good for everybody. And so it's incredibly fulfilling to do that.
No, I'm sure. And obviously to see as well a very happy patient must
amazing.
mean the world.
Yeah. No, it's a lovely feeling.
Very lucky with that.
So then if there is one message today that you would like every patient to take away from today's conversation, regardless of whether they are an Olympian, footballer, or a weekend walker, or they just go to the gym, a few times a week, what would it be?
Don't play competitive sport. I remember in the 70s, there was a government campaign, sport for all. No. Sport's dangerous. But exercise for all, that's a good thing. But I guess I better be more sensible and give a proper answer. I think it's the value of rehabilitation, and therefore nerve muscle conditioning. And if you look at old people walking out of a yoga studio, they look fantastic because their posture is so good. And strengthening muscles is a secret to looking young at an old age and for longevity. So I think that's a really big lesson. Do you agree?
Yeah, I would. I still think competitive sport is really good because I think it just gives you that edge. I think it gives you that.
By the way,
keeps
I
your
do as
brain
well.
up as well. So
It makes the world go round as well.
Absolutely, but definitely exercise. We're so bad. There's an obituary about a lady who's 102. She was still tap dancing in her
Which is brilliant, isn't it?
in her
Coordination,
home.
strength.
And it does. It means it doesn't not just it's well-being, proper well-being, isn't it? It's the mental agility. I think is the competitive side, as well as the physical ability.
I guess the final thing is to say choose your surgeon well, but I would say that. That comes with a lot of bias.
Is there something about doing rehab properly as well, not going back to theatres 10 days post-op?
Yeah, something like that.
Well, no, I agree. You should choose your surgeon well. And, for me as well, I know I've mentioned it, have had 2 extremely successful knee surgeries with Fortius, and without you guys, don't know where I would have been.
Well, that's lovely to hear. I mean, another thing when we set it up was to choose people who we would let operate on our friends or family. And I believe we certainly have those people at the top end.
Well, I absolutely agree. And it's amazing what you've been doing with Fortius so far, and long may it continue.
Well, thank you.
Thank you.
No, of course. So, Andy, James, thank you both of you for your time and for sharing your experience today. It's clear that while elite athletes may perform on the world's biggest stages, the principles behind their care, clinical excellence, teamwork, and personalised rehabilitation benefit every patient who walks through the doors of Fortius. And thank you to everybody for listening to Behind the Best, the podcast from Fortius Clinic. If you enjoyed this episode, don't forget to follow, rate, and share it with someone who might find it useful. We will see you next time, because behind the best, there is always more for you to discover.